I got to give kudos, great kudos to the Foundation for Peripheral Neuropathy. Been on the phone with them, and they're just a great group of physicians. It's a nonprofit. They really just are out there to help us with a resource of where to find good doctors, mostly neurologists. But also they have, yet again, another good document. I've been authorized to go ahead and share this document with you. But this right here are the most commonly prescribed neuropathic pain medications. Let's just start at their top. Certainly the top that we always see is Gabapentin, Neurontin, and then I would have to say after that would be Lyrica. It's definitely on the page. I think it's on page 2, but that's okay. There's other things that you can look toward if Gabapentin or Lyrica aren't working, and you just want some relief from your neuropathy pain. So let's go ahead from the top. We'll start with Amitriptyline. I think you should really get this, download it, study it if you're on it or thinking about going on it. This is a really good document. It's not the end all and the be all. You should go over this with your doctor for sure, as with any medication or anything you're trying for a medical condition. But amitriptyline, we're going to take your eyeballs all the way over here to other benefits. I think it's good to know what these things are, approved for and what their design was. So amitriptyline is FDA approved for the treatment of depression. It's also been noticed and is used pretty successfully in chronic neuropathic pain. Now, with all of these, I really want you to be aware of all of these medications can help with pain, burning, electrical shocks, sometimes tingling, but I usually find them to not be helpful at all with numbness. So if all you have is numbness, we really don't have a drug that can help out so well with numbness. That's what drugs are doing, is they're decreasing numbness. So if your doctor has you on any of these medications and it's just numbness, you might want to have another discussion with them, like, are you really sure this is something I should be doing? And here's why. All medications have side effects, and the foundation here is calling them precautions. Really do read through these, though. With amitriptyline, dry mouth is going to affect almost everybody. Drowsiness is important because that can lead to falls. But it says other less common side effects, cloudy thinking, urinary retention, irregular heartbeat, and upon arising. If any of these occur, you should call your doctor. I think it's really great the way they put this in as well. They just want to let us know that, are there any herbal or food interactions? That's really important. So if you're taking something like St. John's wort, it might decrease the concentration. So it's, again, a good thing to discuss with your doctor. I do see Nortriptyline once in a while. Great, it's got dosages. Again, you check with your doctor on that. Let's go all the way over here. Nortriptyline is FDA approved for the treatment of symptoms related to depression. And they've also noticed it's a useful treatment for chronic neuropathic pain. I don't think it's been authorized or approved, but doctors can use those off-label successfully. And successfully for what? Successfully really of the treatment of your pain. Nortriptyline is not going to fix your neuropathy, but if you're just having a hard time sleeping or just living through the day, this might be a good medication to look into. Again, the same thing. Things to think about, interactions would be St. John's wort. It may decrease nortriptyline's effects and a risk of toxicity. No known foods. Precautions are things you want to definitely know about is a cardiac disease, glaucoma, suicide risk, seizure disorder, concomitant. Now, not everybody gets these, and it's rare, but we should just know risk versus benefit, okay? And once again, nortriptyline drowsiness can occur. It usually goes from, when you're going from one dose up to the next, your body will usually acclimate to that. And we have some really nice max dosages over here, duration of a trial. I think those are really nice. This one, Duloxetine, is most commonly known as Cymbalta. So Cymbalta is approved by FDA for treatment of major depression disorder. And it's also been found to help out with diabetic and other types of neuropathies. I'm not sure why it says diabetic, because I've had other patients come in using Cymbalta and they say successfully. It does seem to help out with the symptoms. Here's your St. John's wort again, and even look on Effexor St. John's wort, right? Make sure you take a look at things like hepatic dysfunction, renal dysfunction. Those are kidney, liver and kidney. Alcohol abuse, and be careful when you're using Tramadol with Cymbalta. Go over this with your doctor. Other less common side effect, cloudy thinking. And I get that a lot. Patients say that, I feel like, I just walk around like a zombie. I hear that with Cymbalta. I hear that with Gabapentin and Lyrica as well. But that might be something to look at. Typically, I see Gabapentin seems to be the one doctors go to most. I'd say probably Lyrica would be their second choice, and then we might see like a Cymbalta. We already talked about Effexor. Let's go over that again. Watch out. Concomitant means if you're using it at the same time, be aware of using it together with Tramadol. This is important for you to know and have a conversation with your doc because it can lead to cardiac disease, withdrawal symptoms, which are pretty gnarly. This is one of those where you really want to check with your doctor if you're going to plan on getting off of it. Even the patients who end up going through my program, or if you're going through this and trying things, work with your doctor on this. Some of these things you can cold turkey on, and other ones is really, really important not to cold turkey. You kind of want to glide down in, take it off slowly. Okay. So Effexor, that's known for depression. And we're going to go on here to page 2. Here's our Gabapentin, also known as Neurontin. Now, that's FDA approved for seizures, actually. I think that's interesting. But doctors and neurologists have found that Gabapentin is, although it's FDA approved for seizures, they have also found it to be helpful with, again, pain, burning, electrical shocks. I've never seen it help with numbness and tingling or balance issues. So if you're on it, I think it can make those things worse if you don't have pain. If you have pain, that's really their number one go-to is gabapentin. So renal insufficiency you want to watch out for. That means kidney. Look at this again, Lyrica, kidney, right? It can lead to sedation, dizziness, and peripheral edema. Something that should be listed here too is that I've also seen it, and you can Google it, but it can also lead to peripheral neuropathy symptoms. I know that's odd, but you look it up, side effect, common side effect of gabapentin, burning, tingling, and numbness in the extremities. It's just something to know about. Not everybody gets it, but think about sedation and dizziness. Those things can add to balance problems. Most of my neuropathy patients already have balance problems, right? If your brain doesn't know where your feet are, how you're supposed to balance. And gabapentin and Lyrica both affect our synapses up here in the brain. It's actually working on how we process pain. It's not working on where you feel the owie. It's really up in the brain. So when it affects the brain, it can cause dizziness, tiredness, feeling kind of loopy like a zombie, which can lead to more balance issues. Well, we pretty much covered Pregabalin or Lyrica. Just for you to know, it's FDA approved for the management of neuropathic pain associated with diabetic peripheral neuropathy and post-herpetic neuropathy. Adjunctive therapy for adult patients, partial onset of seizures. So they're seizures, and it's used in the chronic neuropathic pain. Herbal, there's no known food interactions. And alcohol can increase the sedative effects. You can get really tired with it, fall asleep, and pass out or faint, which is not good, not a good combo. I've had some people come in with a lidocaine patch. Lidocaine is obviously in the same family as cocaine. It's a pain reliever. It can bring upon numbness. Once again, you wouldn't use a lidocaine patch, just like you wouldn't use gabapentin for pain relief. You would use it for pain relief, but you're not going to use it for numbness relief, right? So a lidocaine patch, obviously, you would just put it right on where the worst pain is. No systemic side effects, but it can cause local erythema. That just means like a rash or redness. So that's just something to be aware of. So just kind of have some awareness around that. Tegretol, I don't really see this too often, but it is FDA approved for seizures with complex symptomatology. Generalized tonic-clonic seizures, those are like grand mal seizures. What else do we have? Mixed seizure patterns, trigeminal neuralgia. So it has been found to be helpful. Let's see if there's any herbal interactions not known. Food interactions, grapefruit. So there goes grapefruit. We do see that with some medications. That can increase the absorption and blood concentration of the Tegretol. Precautions, blood counts, liver functions, they got to be monitored. They initially be done 3 months, then every 3 months. So, check with your doctor, make sure they're doing that. And here again, side effects of drowsiness, dizziness, nausea, vomiting. Dry mouth is really common. So ataxia means balance problems, speech disorders, and blurred vision. These are all perfect scenarios, I guess you could say, for balance issues, or adding to what you probably already have are balance issues. And the last most common prescription medication, right, would be Tramadol. Tramadol is FDA approved for the treatment of musculoskeletal pain. And studies have shown that it's useful in the treatment with diabetic neuropathy and other pain conditions. Let's see, with Tramadol, no known food interactions. Probably want to be careful with alcohol. Let's see, precautions if you have a history of substance abuse, suicide risk, driving impairment during treatment, right? So a seizure disorder, concomitant use. If you have any of these things here, you should really discuss with your doc before starting that. And here again, here's some more drowsiness, dizziness, blurred visions. Those are going to, be worsening your balance or cause balance issues, but also nausea, vomiting, constipation. So these are just really important things to know about. I think it's a very good chart that the foundation put together. The main lesson here is work with your doctor. It's good to have something like this to carry into your doctor. Like, hey, I was taking this course and it says here Tramadol, Gabapentin, whatever can cause this. Did you know I'm taking that? Or whatever. There's going to be a whole list of other non-prescription medications for pain relief, right? We know about Tylenol, Motrin, Aleve, aspirin, Advil. Of course, check with your doctor on all of those as well. I think we pretty much covered it. I know there's some other successful things that are out there as always, but again, I got this from the Foundation for Peripheral Neuropathy. They do a great job. It's a nonprofit. If you want more research or a great place to look at either alternatives or common therapies, or even look up local neurologists, you can look to these guys. So that's really going to cover it here for this module. We'll keep it short. I hope this helps. We'll have this in your vault, papers and documents, should you want to get it and print it out. Hope that helps.